Here are the guidelines for colon cancer screening. For patients that are at average risk, starting at age 45, they can do one of the following. They can have a colonoscopy every 10 years. They can have an annual test to check for blood in the stool called the guaiac-based fecal occult blood test, or the fecal immunochemical test. They can also get FIT DNA every 3 years. This is a test where you get sent a box in the mail, you poo in the box, and you send your poo to a company that checks it for DNA that might indicate colon cancer. You can also do a CT colonography every 5 years, or a flexible sigmoidoscopy every 5 years. For patients that are at higher risk, that's patients that have a first-degree relative with colorectal cancer, or that have had a high-risk adenomatous polyp, that's a polyp with 10 or more millimeters in size, a polyp with high-grade dysplasia, or a polyp with villous elements, they need to undergo earlier screening more frequently. So they can do a colonoscopy at age 40 or every 10 years prior to the age of diagnosis in the first-degree relative, whichever comes first. They also need to repeat that colonoscopy every 5 years. The exception here is that if their first-degree relative was diagnosed at an age 60 or greater, then they can just repeat every 10 years, like normal risk populations. Patients with ulcerative colitis are also a special case. They need to start screening 8 to 10 years after their diagnosis of ulcerative colitis, and they need to have colonoscopy every 1 to 3 years.